Welcome. All right, we are going to go ahead and get started. Thank you, everybody, so much for joining me today. We are going to be going over University of Western State's amazing program, Clinical Mental Health Counseling. And I have joining me today the amazing Dr. Amy Johanna. Thank you so much for being here. Really appreciate your time and talking to the prospective students about this program. My name is Caitlin Power. I am the Senior Coordinator of Outreach and Partnership. I will be co-hosting this webinar today. All right. So University of Western States was founded in 1904. We are the second oldest chiropractic college. We were regionally accredited in 1986 by the Northwest Commission on Colleges and Universities. And in 2010, we evolved into a leading institution within the field of health and wellness education. And in 2018, we launched our MS programs. And then we have a list of all of our programs as well listed here. So, as mentioned, we're the second oldest chiropractic school. We also have clinical nutrition, naturopathic medicine, human nutrition and functional medicine, sports medicine, and then sports and performance psychology. So there is a variety to choose from, and you can find more information on different admissions requirements for each of those programs. Today will specifically be catered towards the CMHC program. All right, and I'd love to introduce our program director, Dr. Johanna. Thank you again so much for being here. I'm going to
Sure.
pass it on to you to go ahead and introduce yourself.
Welcome, everyone. It's so wonderful to be connecting with you, even virtually. And first of all, please feel free to reach out to me after this webinar and ask me any questions that you might have about our master's degree in clinical mental health counseling or our doctoral degree in sport and performance psychology with a emphasis or specialization in clinical mental health counseling. I became a counselor because I could do nothing different. I, at the age of 16, knew that I was just wired to be a human helper. And I took a little bit of a interesting path to get there. I started out in teacher education and then sort of found myself in psychology and social work and then came back into the field of counseling when I trained in my master's degree as a mental health counselor. From that point forward, I had encouragement to move into my doctoral studies and become a counselor educator. So I really did become a teacher in sort of a roundabout way, and that's what I've done for 23 years and counting. I love this job. I love my work as a clinical mental health counselor and as a professional educator of counseling. And I hope that shows in this program that I'm going to share with you, our master's degree in clinical mental health counseling. Well, just a little bit more about me. Some of the other things I do, other than my full-time day job as the program director here at UWS, the CMHC program, I love to write. I've written a few books. I write every day, even if it's just an email or a letter or a journal entry. I also have a very small private practice where I specialize in sport and performance populations. Most of what that looks like in Central Oregon, where I live, is recreational athletes. And then I also treat people who have eating disorders, and also work with families who have patients or clients who are struggling with an eating disorder to help them navigate their treatment. I'm a licensed professional counselor in Oregon, and I'm a nationally approved clinical supervisor through the CCE. So our next slide is UWS programs and certification.
Mhm.
The two programs that I'll be talking about today specifically are the MS and clinical mental health counseling, and then our EDD and sport and performance psychology with the clinical mental health counseling specialization. So let's start with the MS. The MS and clinical mental health counseling is a standard counselor education curriculum. We are MPCAC accredited. That's the Masters in Psychology and Counseling Accreditation Council. I know that's a big chunk of words, which is an external accreditor, which basically ensures that our curriculum is up to par, that what you are learning in this program is going to be what you need in the field and also what you need to license. Our curriculum is board approved in 47 states currently, which means that when you finish our counseling program and graduate and apply for your professional counseling license, which is required in any state you practice in, that it will meet the educational requirements for your licensure. With your master's in clinical mental health counseling, you can work in private practice, you can work in behavioral health care settings, hospitals, lots of different career paths. You can also, as a trained counselor, you are an expert in human communication and human assessment, and just human relating. So some of our grads actually use their counseling degrees not as a clinical mental health counselor, but they've expanded into other career paths, which brings me to the EDD in sport and performance psychology. This is an incredible program. I think it's one of the only ones in the United States, which basically is a terminal degree, a doctoral degree in sport and performance psychology. Along the way, you complete our curriculum in clinical mental health counseling. The first 90 credits are your master's in CMHC. So essentially, you come out of this program with 2 degrees, a doctoral degree with your master's degree in clinical mental health counseling. And with this degree, you are trained to you've expanded your career trajectory quite a bit because you are trained to not only do the work of clinical mental health counselors, but you are also trained to be an expert in sport and performance consulting. So ultimately, you can license as a clinical mental health counselor as well as earn your CMPC, the Certified Mental Performance Consultant credential, through the Association of Applied Sport Psychology.
That's awesome. Thank you so
Yes.
much for explaining. That is really, really cool that UWS offers that here. All right.
Yeah, I'll just make an extra comment about that. Again, I think this is a very unique program because we really focus on the integration of the two. It's not just one degree and another degree that are just sort of sandwiched. From the very beginning, students know that they're getting a terminal degree, they're getting their doctoral degree.
Hmm.
But the first part of that degree is the clinical aspect of it, and then the second part is the sport and performance aspect. But throughout the CMHC portion of the degree, which is this is what sets this program apart from other counselor education programs. Throughout the degree and the curriculum, you're going to see elements of sport and performance psychology in your theories courses, in your content courses, and in case studies. We talk about that quite a bit. So our classrooms are really filled with a diversity of students just in the sense of how they plan to use their curriculum to ultimately achieve what they want to in their career.
That's phenomenal. Thank you.
Rehab counselors are licensed professional counselors with an additional set of training. And our program now offers that training for those who are interested in becoming a certified rehabilitation counselor. And we offer 2 pathways. The first pathway is for LPCs or licensed professional counselors who have already completed their counselor education curriculum, are already licensed, and want to sit for the certified rehabilitation counselor examination. In a standard counselor education curriculum, you would not get the courses that you need in order to pass that course or pass that exam.
Hmm.
This certification does train you to be able to sit for that examination. You also need to do supervised clinical hours, but that is outside the scope of the certification. For those interested in the master's degree in CMHC or the EDD in sport and performance psychology with the CMHC specialization, this can become part of your curriculum. So not only could you train for your master's degree, but you could also, as part of your electives, select the electives that you need to eventually sit for the certified rehab counselor examination after you graduate, which is really a
Nice.
very nice, cool offering and very representative of our integrated curriculum.
That's great.
So this slide shows the planner of what those courses would be. If you wanted to take the curriculum as if you wanted to complete the coursework as part of your master's or EDD curriculum, you wouldn't actually be getting the certification because it's already adopted into your curriculum. You would just work with your advisor in order to get the courses you needed. And then in your clinical placement, which I'll talk about in a minute, you would need to ensure that you did that in a rehabilitation setting, and our clinical coordinator would help you with that placement.
Thank you for walking through that process.
Sure.
All right. So I know there's a ton of different schools to choose from. I would love to hear, Dr. Hannah, kind of what you have to say about, why would a student land on University of Western States? What about us stands out, and what about this program stands out?
Well, first of all, we're small and we value students. We know your names. Our dean will know your name. You will not get lost in a classroom, and we are 100% committed to your growth and training and getting you to the place where you want to be in your career.
Hmm.
UWS is a unique institution because we are an integrated healthcare institution. Our whole brand and mission is whole person health, holistic wellness. So, not only will you have the opportunity to train in a master's in clinical mental health counseling program, but you also will get exposure to things like biopsychosocial functioning, pain management, how to talk with other practitioners and providers like chiropractors and sports medicine professionals in order to treat your client and get your client or patient the care that they need in a holistic manner. We also have a very, very cool aspect of training called our standardized patient program. I never had this as a student or as a counselor educator teaching in other programs. Standardized patients are trained actors who are very convincing, who basically portray a mental health client where you get to practice with that individual before you ever see a real client. So let me tell you a little story. When I trained to become a counselor, I was 26 years old, and I initially started out as a school counselor, and I was placed in a school. My first client that I was ever going to see was named Brian, and he was a fourth grader. And Brian scared the poop out of me because he was the most unassuming, sweet, kind little boy that I have ever met, but I was terrified because here am I, supposedly someone who should know something to be able to help Brian and adjust to school. I think he was having some family stressors. So imagine what it would feel like for you if you are training to be a counselor and you take your theory courses and you read your books and you do the case studies, and then all of a sudden, third quarter, fourth quarter in, we tell you now you're going to go to your practicum and you get to see your first client for the first time. By the way, they're a little depressed and might be suicidal. That would be terrifying, right? So, we take that away in our standardized patient program because the very first client you see, it's not a real client. Yeah, it's an actor, but boy, they sure feel like a real client. So you not only learn your skills, but you get over your nerves and you develop the confidence you need in order to be able to work with clients. And by the time you finish your pre-practicum course, which is your standardized patient course, then, if everything's thumbs up, we will place you in your clinical practicum, and you can get going seeing real clients. So
That's
that's one
awesome.
really awesome feature of this program. Again, you can feel confident in your curriculum that you will be prepared for your state licensure, including your required academic courses, educational components, and clinical hours. Um, in order to license in every state, you need to pass a national examination, which is not governed by us, that's governed by external accrediting agencies and external credentialing agencies. And those two examinations are the National Counselor Exam, the NCE, or the National Clinical Mental Health Counseling Exam. And our students pass those exams with flying colors. So, if you're looking again for a program, I think just looking at it from the eyes of a student, an online program that is 100% online, except for your clinical placement, is very accessible. You don't have to move or relocate. because we're a private institution. There's no out-of-state tuition. There's no master's dissertation requirement or master's thesis requirement. If you do the EDD program, you are required to do dissertation. Sorry, folks, that's just the way. It's just what it takes to get a doctoral degree, but we have a lot of support for that. And then finally, we have rolling admission with two admissions quarters, fall and spring.
Amazing. Thank you for going over those things. I think that's really important. And the standardized patient aspect has always been really cool to me.
Yeah.
As someone that did theater growing up, I just love the
hmm
fact that you guys get these actors to come in and it's that face to face that's, no book is going to prepare you for that. So I love what you touched on there.
Absolutely. And we have that program not just for the CMHC program, but also our sport and performance
Hmm.
psychology and our chiropractor programs and our other programs as well. So it's just a part of healthcare training.
Yeah, that's really great. All right, here. And we'll go through a quick overview of the degree.
So an overview of the MS-CMHC degree, it's 90 quarter credits. So we are all online except for your clinical field experience. That is done over 5 quarters in your local community. We have a clinical coordinator who will assist you with your placement, finding a placement because there's parameters for supervision and what the site can provide for you or must provide for you. Most students, so if you take 3 courses a quarter, you can complete this program in 8 quarters or 2 full calendar years. That's about the standard length of a counselor education program. We recognize that many of our students are working and have families. So I would say for most students, it's between 8 and 12 quarters, just kind of depending on your needs. And we have admissions quarters April and October, and currently are open to US citizens and permanent residents of the United States. And that's related to your clinical field experience, placement with legal requirements placing students in the United States.
Now, is this asynchronous or synchronous, this program?
Both. Most of your content courses are asynchronous, which means you log in when it works for you.
Hmm.
You have deadlines and due dates weekly. You need to do assignments every week for every course. Every content course, and what I mean when I say content, those are your theoretical courses, your electives, the courses where you will read and study and then do work. Many of those courses also involve discussion forums, so you are interacting with your peers. And some courses have group projects, not all, but I'd say maybe on average you would have some kind of group project or group interaction once per quarter. In every content course, the instructors offer 3 synchronous meetings via Zoom. The instructors schedule those as per their schedule, but they always record them so students can view them later if you can't attend for whatever reason. Again, we know you're busy and working. Your clinical field experience is synchronous. So that means that when you begin your practicum and your 4 quarter internship series, it's 5 quarters total, you will be placed in your local community and you physically go there. You physically go and see clients, meet with your site supervisor. In practicum, that's about 10 to 12 hours a week. And for internship, it's about 12 to 15 hours a week where you will actually be going somewhere and seeing clients synchronously.
Great. Thank you for that overview.
Yeah.
All right. Now, I know you already kind of talked about
Yeah.
our standardized patients, but is there anything additional that you'd like to add?
Um, Probably not about standardized patients, other than it's just a really great experience. I love teaching that class, and I think our students just feel so confident. I will also mention SkillSetter, which is another platform we use. We tend to use this in very early on in the program, which is a platform where you actually watch a video of a client, or it's an actor portraying a client. You watch them as if they are speaking to you, and then you respond to them in real time, and you actually videotape yourself responding, or you can chat in your response, and then your instructor views the entire interaction and gives you feedback. So that's the very entry level is skill setter. Then we move, and then if the thumbs up there, we supervise you, we watch your work. which is an aspect of clinical training that you should probably be very aware of, that you are practicing from day one, and you are being evaluated and given feedback, and you are being recorded, videotaped, and given feedback on that. It's nerve-wracking. Yes, you will get over it and get through it. We all did it. We all know how scary it is. We all get through it and we all do well. Once you do the skills the way you need to and perform successfully on those, then you're approved to move on to standardized patients, then you're approved to move on to practicum, internship, and all the way through. So that's sort of the process of how we train clinical students.
Great. Thank you so much.
Mhm.
All right. And we'll go over more about the program structure.
Sure. So program structure, this is again is pretty standard to counselor education. We are on a quarter system. So we go on 4 quarters a year for 11 weeks. Generally, the first 10 weeks are instructional weeks, and then the last week is a finals week. Time commitment. Students often ask, well, how much time am I going to spend studying? How much time do I need to commit to this program? I generally say for each course, plan on 9 to 12 hours of work, depending on your study habits. Some students read really fast, others it takes longer. For some students, it works to have a study schedule. Others just navigate it, during work breaks or when they can. But generally, I would say what I will say is this is a full-time clinical program. Sometimes students think, oh, it's an online program, we can just get through it. That is not the right attitude to come into this program with. This is a full-time graduate clinical training program. You will be working hard and studying, as you should be. We want to make sure clinical mental health counselors are trained really well before they go out into the field. So again, these are averages. It really just depends on so many things. And you kind of learn what works for you your first couple quarters in the
Yeah.
program. One of the biggest questions I get from prospective students is what's the difference between a counselor, a social worker, a
Mhm.
marriage and family therapist, and a psychologist? And the answer is your license.
Yeah.
And your license depends on your training. We are training you to become a licensed professional counselor, and the scope of practice is the assessment, diagnosis, and treatment of mental disorders. So you will be using the DSM-5 in order to help people overcome mental health challenges, symptoms, and diagnoses. LPCs work with individuals. We do work with couples and families. We work with children and youth and all developmental ages. We are also trained to work with many different cultures and ways of understanding the world and people with multiple lived experiences. So that is an important thing to know. Counselors generally treat the client, whereas marriage and family therapists treat relationships. Again, it's a different license in your state. Clinical social workers treat systems and
Mhm.
advocate for people within systems. The system is the client. Psychologists treat or work with all different kinds of people, generally individuals, and additionally add an element of evaluation. So psychologists do psychological evaluations. So again, it comes back to the license and the client. For an LPC, the client is the person. For an LMFT or licensed marriage and family or couple therapist, the client is the relationship between people. For clinical social workers, the client is the system and people within the system and advocating for them. And psychologists, again, can work with all three, but add that additional element of evaluation. Psychologists almost always have a doctoral degree in almost every single state. So we are not training you to be a psychologist, and neither does if you do select the EDD in sport and performance psychology. You cannot call yourself a psychologist after you come out of that program. You can call yourself a licensed professional counselor once you graduate and earn your license in your state. You can call yourself a performance consultant at the doctoral level.
Great. Thank you. All right, next slide here is a breakdown of the curriculum.
Sure. So in our program, you can take up to 5 years to complete it. And again, we are very standard counselor education curriculum, but we do go beyond that just with our integration with rehabilitation counseling and sport and performance psychology. In a standard counselor ed program, you would expect courses on ethics, personality and counseling theories, counseling methods, which is actually how to do counseling skills, psychopathology and diagnosis, human growth and development. We have a great psychopharmacology course with an amazing instructor for that, multicultural competence and humility in counseling. And then we offer a lot of different specializations that you can look at. So, career counseling, group counseling, we have a great play therapy course. We have a trauma-informed treatment course, although trauma-informed care is woven throughout our curriculum, as is cultural humility and professional ethics. So you'll get that in all of our courses. We have an addictions course, a lot of very cool electives. Um, and students in this program you actually have 12 credits or 3 courses of electives. So you can select electives in the sport and performance curriculum, and obviously rehabilitation counseling as well. This is our MS Planner.
Mhm.
So you can see the list here of our core courses. This planner is not really sequenced perfectly. It's almost impossible to get a perfect sequence, meaning what courses should you take first, second, third, and then so on. Generally, your very first quarter, you will be taking, you have to take ethics. That's your very first course. And then your earlier courses will be counseling methods and practices. Um, you'll also be taking personality and counseling theories and multicultural counseling. That's generally the first set of courses, and then you'll move in as you progress to quarter 3, you'll be looking more into pre-practicum and sort of weaving in courses such as psychopathology and diagnosis, tests and assessment. Along the way in there, you need to take research methods and program evaluation. Yes, counselors, we are science. We are science practitioners, so which means we use science and research to inform our practice and write treatment plans. Career and vocational counseling is another great area. It's part of our core curriculum because most people don't know counseling actually came out of the vocational field. And that's why it's sort of our heritage, and that's why it's always included in the core curriculum. And I always argue that you wouldn't be here if it weren't for a vocation, right? You wouldn't be seeking a graduate degree. So we are all workers in some component. We all have a vocation, whether we get a paycheck for it or not. And that is part of human development and a very key aspect of our core curriculum. So this represents our core curriculum. And then I think our next slide might mention our electives. Let's
Yes.
flip to that.
Yes, we have.
Yes, so our elective courses are here, so you can see some of the options you can take: eating disorder treatment, business basics, which helps people basically learn how to run a practice or create a business, play therapy, ethical use of telehealth platforms, and trauma-informed care, and then some other electives here. Human sexuality counseling, highly recommended, along with play therapy if you want to work with youth and families. And then some of the sport and performance psychology electives there as well.
Great. Awesome. So many options,
Mhm.
and I love how well-rounded
Yeah.
it is. You guys really touch all the different areas, the business side of things, the speaking to standardized patients, that face-to-face, as well as the research side, which is really, really cool.
Well, I think that's a very key element of our program
Yeah.
because when I went through my master's in counseling, I had zero flexibility in my courses. It was a program that was governed by external accreditation very narrowly. I had no electives, and basically the courses that were listed were the courses I taught. In this
Yeah.
program, we very much value integrated care, whole person wellness, and so we want students to design their career, which
Mhm.
also means designing their degree in the
Yeah,
way that works for them, where they plan to practice.
that's so important.
Yeah.
Oh, that's great. All right.
So finding a practicum or internship, this is a big question for prospective students as well. Like, how would I, like, let's say I live in a very rural part of North Dakota. How do I find a placement where I'm actually going to go and see my clients? Or do I have to move for my placement? So, first of all, you don't have to move, but some students do. I've had students who found a placement out of state and it just felt like a really good fit for them, so they moved. Um, most students stay where they're at locally. Most students have some form of a connection, like they might know someone working locally or an agency where they might be interested in working after they graduate. So first thing is we ask students, where do you want to do your clinical field experience? And do you have any connections in that area? From there, we do have a placement coordinator, a clinical coordinator, who's one of our core faculty, Dr. Tiffany Darby, who works with students on finding that practicum and internship. Works with students, everything from the legal requirements, the documentation requirements, the training requirements. Again, we require, like most counselor ed programs do, students to electronically record their clinical work, which is done through a platform called Supervision Assist. It's all HIPAA compliant. So students use that to record their sessions with their clients. And then those recordings are used in clinical supervision, both on-site and individual supervision with their site supervisor, who's local, and in group supervision, which is done through the university with a university faculty supervisor 90 minutes a week. So basically, you're getting 2.5 hours of supervision per week that you are seeing clients. So you are not left alone here. We are always watching you in good ways to help you develop and grow the skills that you need in order to graduate and get your license. So field experience requirements, again, we start first with practicum, and that's sort of an entry into seeing clients. It's 1 term. 100 total hours, which breaks down to about 10 to 15. I'd say it's probably about 10 hours a week. Again, just kind of depending. These are averages too, so some weeks it could be more, some less. But at the end of the quarter, you need 100 total hours with 40 direct counseling hours, and direct counseling hours are face-to-face or voice-to-voice contact with clients. They're not peer role plays. They're not standardized patients. They're actual people who've signed an informed consent saying, yes, I'm going to see you as my counselor, intern, or practicum student for the purpose of assessment, diagnosis, and treatment of any kind of mental disorder or emotional distress I have. So I talked a little bit about supervision back there. So
Mhm.
what do you actually do in your field experience? You do intakes, which include biopsychosocial assessments. You can diagnose as a student with sort of a cosign or oversight by your site supervisor. You can do individual sessions. Co-therapy is where you might be doing co-facilitation of a group or even individual or couples therapy. In internship, that is 4 terms, so it's one full calendar year. Some students take an extra term or two, just kind of depending on their needs. 10 to 15 hours a week at your site. You do have synchronous supervision. Supervision is always synchronous. There's no way to do asynchronous supervision. So again, that's 1 hour with your site supervisor on site and 90 minutes with your university supervisor, again, synchronously. And we just offer certain sections where students sign up for that. You will have to modify your schedule for supervision and for your field experience. It's just part of the training. So we do want to let students know that by the time you begin your clinical field experience, you should have some flexibility with your current job or life or hours. Students can some often find sites with alternative times. Like, for example, if you work during the day, you can find a site maybe at a residential or hospital setting where you could do evening and weekends if needed. But supervision always takes place during the week.
Great. Thank you so much. All right. Now I'm going to take over here for a couple slides. Thank you again, Dr.
Sure.
Ohana,
Yeah.
for going through. just so insightful, and just this is going to be a really good resource for students, so I really appreciate it. Um, So I'm going to talk a little bit about admissions requirements. So if you are ready to apply to UWS, we really recommend that you talk to an admissions counselor as soon as possible. And that way you can know the timeline of the application process and what is required. So we can also answer any questions and help see if, we are the right fit for you. So we do have phone advising appointments that you can set up. And then also we will be needing official transcripts from you and from every institution that you've attended. And getting those to us as soon as possible is really helpful. And we also have all of our deadlines posted online. And that's where you can kind of have an admissions counselor help you map out, when to get everything in by. There will also be an essay that you'll need to write as well. Interview process, Dr. Ohanna, do you want to talk a little bit about what that process, what students can expect?
Sure. So, we'll give you some materials to read through, such as the codes of ethics, to prepare beforehand, and then you'll be meeting with at least two faculty members depending on the program that you are applying for. In the MS program, you'll be interviewing with myself and Dr. Angel Brutus currently. And then if you're applying for the EDD program, you'll be interviewing with the SPP program director, Dr. Sarah Castillo, and then likely another CMHC core faculty member.
Great. Thank you so much. So that is what you can expect. If you have any questions or concerns about any part of the application process, that is why it's so important to touch base with an admissions counselor, or I'm sure Dr. Ohanna is also available to students as well. So we will also ask for a tuition deposit, and so that is something that is required. And we also require a background check as well that you must successfully complete and pass. All students must be enrolled for financial aid resources. All students must be enrolled in 5 quarter credits each term, and they must remain in good academic standing. So what this means is a 3.0 GPA or higher. If you have any sort of financial aid questions, please contact them again as soon as possible. And I have provided their contact information here. Payment plans can be set up through financial aid. Scholarships can be found through financial aid. So it is really important to take a look at those again as soon as possible. So you might be thinking, where do I go now after watching this webinar? And there's a couple places. So you can schedule a time to talk to an advisor, set up an advising appointment with an admissions counselor online, or start that application process on our website as well. And just remember here that we do have a couple different deadlines. So, Dr. Ohanna, do you want to talk about when the next cohort would be for students to apply?
Yeah, so we are on the 9th of September. I think we're done with recruitment for fall quarter,
Mhm.
but I would encourage you, if you're interested in this program, get your application in, just get it
Yeah,
in, and we will go from there. So certainly we have openings for spring 2026. If you're
great.
interested in the rehabilitation counseling certification, I know for sure we have space, probably even in the fall quarter. So
Perfect.
again, whatever your interest is, get in touch with an admissions counselor. Just get in the queue
Yeah.
and we'll get you where you need to be.
Yeah, definitely not something to put off. And we're here to help. We really are. So you can always give our office a call or shoot us an email. With that being said, we have additional contact information here. So we do have our admissions email, and that is checked regularly every single day, daily throughout the day. So please shoot us an email, and you can also check out our website for more information. But that completes the webinar. So I just want to thank everybody, and I want to thank Dr. Ohanna again so much for taking the time to chat with us. And we hope that you will apply to University of Western States. And again, if you have any questions, just feel free to let us know.